Welcome to episode 3 of Medically Speaking-ish, where we break down the latest medical and public health news into quick, evidence-based updates. Each week, we take trending topics from around the world and translate them into information that is practical for clinicians, public health professionals, and anyone who values accurate, timely health insights. With just a hint of dry humor to keep things interesting, a country has just eliminated malaria. The World Health Organization wants to raise taxes on unhealthy products. And new research shows your social life might be one of the most powerful medicines you have. Here is what is trending in medicine this week. Let us start with the World Health Organization's push for higher taxes on tobacco, alcohol, and sugar-sweetened drinks. This is not simply about making unhealthy options more expensive. It is about reducing consumption and funding preventive health care. Research shows that a 10% price increase can reduce tobacco use by up to 8% in low and middle income countries, while generating much-needed revenue for health systems. In other words, well-designed policy can save lives as effectively as medicine itself. Speaking of public health victories, Suriname has achieved something remarkable. It is now officially free of malaria. After years of mosquito control, rapid diagnostic testing, and community engagement, the country has gone 3 consecutive years without a single locally transmitted case. This shows that disease elimination is possible with persistence, targeted interventions, and long-term commitment, even outside of high-income settings, from disease prevention to something much closer to daily life. Your friendships and social connections may be as critical to your health as your cholesterol levels. A meta-analysis published in the journal Nature Human Behavior found that strong social ties can reduce the risk of early death by around 50%. That is a benefit comparable to quitting smoking. Loneliness is not just an emotional state. It is a measurable health risk, and one that deserves more attention in clinical practice. Of course! No Global Health Roundup would be complete without touching on the coronavirus disease 2019 pandemic. The World Health Organization's latest report on the origins of the severe acute respiratory syndrome coronavirus 2 does not provide a final answer, but that is not the most important takeaway. The report focuses on strengthening genomic surveillance, improving laboratory safety, and detecting outbreaks earlier. Whether or not we ever identify the exact origin, these steps will prepare the world for the next emerging threat. And finally, let us talk about electricity. Something many of us take for granted. Yet 675 million people around the world still lack. Without reliable power, vaccines cannot be stored safely, surgical procedures become high risk, and telemedicine is impossible. The World Health Organization is now framing energy access as a public health priority, and rightly so. Infrastructure, in many cases, can be as life-saving as any drug or treatment. That is your quick dose of trending topics in medicine. If you found value in this update, share it with a colleague. Subscribe for more weekly insights, and keep your clinical knowledge sharp with Medically Speaking-ish.